There are many factors that can go into a cost of an implant, not only on the type of implants you're placing. Depending on the condition of your bone, you may need grafting. So if you don't have enough bone, there are procedures that need to be done beforehand or along with the implant placement. So using a good implant with a good reputation and research background is critical. Experience is critical in this as well. The flat price of implants that I see sometimes advertised on billboards doesn't make any sense because everybody's condition is different and it's never a flat fee situation. They need to get them evaluated properly to see what it is that they're actually going to need. The way that we do the implants is we make sure that we are evaluating the patient properly through the use of the CT scan and identifying all the pitfalls that could come along the way. Amount of time and education I've put in to make sure that we can make our implants be successful, I feel is an important reason for patients to choose an office and do their research before jumping into a lower cost implant.